Hello everybody, my name is Michaela Davis and this is my critical assignment for the class Care and Prevention of Athletic Injury. So a little side note, the reason I am doing it with my computer and myself and my phone is because my speaker on my computer went out last minute as I was trying to film this and I did not have time to fix it. Everybody was closed, so this is why I'm doing it like this. I improvised and I think it's still good because you can see the computer, the PowerPoint, and me. So the sport that I chose, is football. And the first injury that I chose was a thigh contusion. So the anatomy of a thigh contusion is the impact crushes the muscle fibers and connective tissue, causing the under your skin to bleed, and that's what causes the bruise on the outside of the skin, which is black and blue usually, and it's also called a bruise. So this is according to Healthline. So I listed two mechanisms of injuries for a thigh contusion. The first one is caused by a direct impact to the quadriceps, and the next one is caused by trauma to the quadriceps as well. So this is according to Healthline. And an example of a direct impact to the quadriceps would be, let's see, a linebacker or a defense going into offense into their thigh, hitting them with their helmet or their leg, hitting somebody else's thigh, causing a thigh contusion. This picture really shows how a thigh contusion is developed. This is the bleeding underneath the skin, and then this is the bruise-like effect that you see on top of your skin. So how do you assess a thigh contusion? So there are many ways to assess a thigh contusion, but the main way is to apply the Price principle. So the Price principle basically means to protect the area, to rest the area, to ice the area, to have compression and elevation to the area. So if somebody gets a thigh contusion, they're going to want to do this ASAP after the contusion happened, just to bring the swelling down, to bring the pain down, to stop the bleeding underneath the skin. This is all according to Sports Injury Clinic. So I have listed 4 exercises here for a thigh contusion. 2 are preventative and 2 are rehabilitative. So the first one are preventative. I have wall slides. I listed 2 sets of 8, 3 times a week, and the progression would be the front lunge. The next one, I have a step-ups. I have 2 sets of 10, 3 times a week, and then pistol squats would be the progression. And the rehabilitative, I have a straight leg raise, 2 sets of 6, 4 times a week, and a front squat. The leg extension, 2 sets of 12, 3 times a week, and a short arc quad would be the progression. All these are going to strengthen the quads. They're going to help the quads build up, more muscle, and so the contusion next time, hopefully not, but if somebody gets a contusion the next time, it'll be stronger, the contusion won't be as bad. Here are the videos I have listed of how to do the wall slides and straight leg raises. Those are 2 of the exercises that I chose to show you how to do. The next injury that I chose was a hamstring strain. So the anatomy of a hamstring strain is there is 3 types of muscles that are in the hamstring group, and the bicep femoris, the semimembranous, and the semitendinitis. So those are all of the hamstring group, and when one of them is pulled too much, it can have a strain within it, and just like it says here, it can extend too much and it can be pulled. This is according to Sports Medicine Australia. So here I have 2 mechanisms of hamstring strains, of injury of hamstring strains. The first one is it can be caused by a sudden movement. The second one, it can be caused by a force being applied to the hamstring muscles. This is also according to Sports Medicine in Australia. So for an example of force being applied too much to the area would be if defense is piling on top of offense, all the weight, the force of the weight can cause somebody's leg to extend too much, causing a hamstring strain. So how do we assess a hamstring strain? So a test that can be done is an MRI to see if the hamstring is torn, pulled, strained. An MRI can tell all that. You can also do the RICE method, which is rest, ice, compression, and elevation. This is all according to Mayo Clinic. And like I said, at the last injury, you want to do this as soon as the hamstring is torn or pulled, to bring down the swelling and to bring down the pain. So I have 4 exercises again. So 2 preventative and 2 rehabilitative. So the preventative that I have are sumo squats. I have 3 sets of 5, 4 days per week, and a deadlift would be the progression. The next preventative is a glute bridge, 2 sets of 10, 4 times a week, and a single leg glute bridge would be the progression. So some rehabilitative exercises would be a hamstring curl, 2 sets of 12 and 3 times per week, and a single deadlift would be the progression. And a hip extension is the next rehabilitative exercise. I have 2 sets of 8, 3 times a week, and a straight leg balance would be the progression. So these will all help with strengthening the hamstring muscles and also bring them to their, to strengthen them really well, so when all that force is piled on them, that they don't tear as easily as they would if we weren't strengthening them. Like, again, there's videos of 2 of the exercises just to show you how to do them. And the last injury that I chose was an MCL sprain. So this is a medial collateral ligament sprain. It is the ligament right there connecting the 2 bones together. So the anatomy of an MCL sprain is the medial collateral ligament inside the knee is being torn when impact hits the knee. This is according to Sports Injury Clinic. So again, I have 2 MOIs listed, mechanisms of injury of the MCL sprains. So one of them is it can be caused to a direct blow of the knee, and the next one is it can be caused by a valgus force to the knee. This is according to Sports Injury Clinic as well. So as you can see in this picture, the basketball player's foot is turned outward, which her knee is turned outward as well. So this happens in football a lot too, when the football player is going to make a sudden change. That's a valgus force. They can fall on their knee like that, causing the MCL to tear. And that's one of the most common ways that the MCL can tear. So how do you assess an MCL sprain? So again, you can do the MRI, and it'll show if it's torn or not. And then one of the most common ways is physical therapy. So the physical therapist will assess you and give you a rehab program, and you can go into physical therapy, and they'll focus on safely regaining the strength and the mobility of your knee and your MCL. So again, I have 4 exercises for the MCL and how to strengthen them. So 2 preventative would be calf raises. I have 2 sets of 10, 4 times per week, and mini squats would be the progression. And the next preventative would be wall squats. I have 2 sets of 10, 3 times per week, and sit-to stands would be the progressions. So 2 rehabilitative would be a forward lunge, 3 sets of 6, 3 times a week, and a knee extension could be the progression. And a straight leg raise is the next rehabilitative exercise. I have 2 sets of 10 4 times a week, and a hamstring curl would be the progression. Now all these are going to strengthen your MCL and your knee ligaments, as well as some other muscles in your body as well that come along with them, but mainly your MCL and your ACL, as well as your meniscus, and that will help all of them give strength. And so the next time that all the force is piled on, your knee won't tear, your MCL won't tear, and the valgus force won't be applied as much. So again, I have 2 videos of the calf raises and front lunge. You can check those out if you don't know how to do them properly. And at the end, I have all the references. And that is all from my critical assignment for care and athletic prevention of injury. Thank you. Have a good evening.